Hey guys, it's Dr. Justin Marcagiani here. Today's video is going to be on low progesterone and heavy bleeding. I'm excited to dive into this topic. This has been a topic of conversation with a lot of my patients this week, so we're going to dive in. Before we do, please smash that like button. It really helps the YouTube search algorithm. Put your comments down below. Let me know your experience with hormonal imbalances, heavy bleeding, low progesterone, etc. We're going to dive in. We're going to do a little physiology 101 review just to make sure everyone kind of understands kind of the starting point of what we're looking at here. And then we're going to talk about action items and solutions, because functional medicine is all about getting to the root cause and not just covering symptoms up. So hope that makes sense. Hope you all are very excited to dive in. So we're going to do some images and pictures on screen. Hope you guys like it. If you do, give me a thumbs up. Make sure you let friends and family know so they can get access too. All right, so check this out. I'm going to shrink me here. I'm going to pop this guy up here in the background. All right, cool. So we got a couple of images here that I want to highlight. So one of the things that we're talking about out of the gates is called a luteal phase defect. So you can see this. This is your month cycle, right? So in a nutshell, let me get this a little bit bigger for y'all. All right. Let me get this a little bit bigger for you guys. Okay. So first off, out of the gates, you're going to have your luteal phase, and that's going to be the second half of your cycle right here. So first off, you start your cycle menstruating, bleeding. The first 3 to 7 days may include bleeding. Let me actually switch. There's a better picture for this, and we'll kind of come back around. All right, this is a better one. So this is day one. Day one right here. So you can see 2, this is 1. Okay, and in this image, what you're seeing here, this is where your endometrial lining is starting to thin. This is where the period happens. You're taking this endometrial lining that had thickened up from the previous cycle over here, and you are actually sloughing off that lining. So what you're seeing here, this is the day one for the next cycle. You're sloughing it off, and then it's coming into this picture where you can see you're totally getting that uterine lining that was thickened up throughout the hormonal changes, and you are thinning that down. Now, what causes that is a drop in estrogen and progesterone. So that drop in estrogen and progesterone right here, you can see it over here, progesterone and estrogen, that drop is what triggers this uterine lining to then slough off. And then you can see what starts to happen over time throughout that month. You're going to see a recruitment of FSH, which starts to take the follicle over here, which is where the egg is growing, and it starts to mature it. As that follicle starts to mature, then the follicle starts to trigger estrogen production. So you see estrogen going up right here, and it taps out usually around day 12 or 13. That rise in estrogen then triggers LH to then go up, which is luteinizing hormone. Luteinizing hormone then triggers a rise in progesterone right here, typically around day 13, where it peaks around day 15 to 16 or so. This in-between area is ovulation right here. And then from that point, this is where we enter the luteal phase. The luteal phase is where progesterone predominates, okay? And so progesterone happens, it kind of tapers up like a roller coaster, and then gently goes down, and that drop in progesterone, primarily followed by a little drop in estrogen, is what triggers this uterine lining to slough off. So now if we go back now with eyes that can see, same thing here. Right, here's your bleeding. This is days like 3 to 7. This is where your estrogen predominates. Then your luteinizing hormone starts to go up. That then triggers your progesterone to go up, which you can't really see it in this here. It typically, progesterone would rise like this. In the middle is ovulation, and this is your progesterone in the last half of your cycle. Now, this image is better for the luteal phase defect, because really what we're seeing here with the progesterone is this last half kind of falling out soon, falling out too soon. So if we look at it in this perspective over here, right? Let me go back to the exact image again, right? Just to kind of recap, we have the endometrial lining sloughing off. That's due to the drop in hormones from the previous cycle. That then triggers a rise in FSH, follicle stimulating hormone, which then increases the follicle maturation. The follicle then triggers estrogen. Estrogen then triggers a rise in LH, luteinizing hormone. Luteinizing hormone then triggers a rise in progesterone. And then in the in-between, estradiol and progesterone is where we have ovulation. This is the only time you can get pregnant. And then we have the luteal phase, and a defect would be that last half of that progesterone falling out, okay? And so most women have issues in this area. And so I hope this kind of makes sense. So in other words, if you look at me, I'm going to bring myself back on here 100%. I know it's a little bit confusing. Think of fertility and your cycle as like a domino rally. Okay, let's make sure it makes sense. The first domino that falls is going to be menstruation. That's bleeding. Okay, 3 to 7 days. That's step one. Step two, you're going to have a rise of FSH, follicle stimulating hormone, that causes the egg, that follicle, to mature into an egg. Okay, that egg then triggers estrogen production, estradiol. That estrogen production triggers luteinizing hormone. That LH production stimulates progesterone. That in between of estrogen and progesterone, X marks a spot. This is where you ovulate. Then you have this rise in progesterone for the last half of your cycle. And if it goes out early, this is what we call a luteal phase defect, that drop in progesterone. And this is a major driver of hemorrhagia, excessive bleeding, excessive menstruation, because that progesterone is really important for signaling and sloughing off the uterine lining. And if we do it too soon and premature, it's going to cause menstrual issues. So just kind of recap, domino rally. Drop in estrogen, progesterone triggers menstruation. Menstruation then triggers FSH. FSH triggers follicle production and maturation. Follicle stimulates estradiol. Estradiol triggers LH. LH triggers progesterone. Between estrogen and progesterone is where ovulation happens. Progesterone then arcs throughout the last half of the cycle, drops, and that's where menstruation starts again. So hope that makes sense. I just want everyone to have, I know it's a little confusing, but it's just physiology 101. If you understand that, then you can plug and play a solution in here, and it's like, oh, that makes sense. I get that, right? So of course, why do we have these low levels of progesterone? So progesterone can be used to kind of pinch hit for stress hormone cortisol. So if we're chronically stressed and inflamed, progesterone can easily fall out and go low. All right, and then that can easily drop out progesterone. And then, of course, if you're chronically stressed as a female, dopamine's a tonic inhibitor of prolactin. And so then if you start to get stressed and your dopamine drops, that causes an increase in prolactin. That can throw off the cycle as well. So there's a reason why stress affects dopamine, dopamine affects prolactin. Obviously, progesterone and cortisol are connected with stress. So you can see a woman's cycle is so delicate, right? And if we start to create stress and inflammation, it can really, really throw things off. And so we want to be cognizant of that. So one of the first things we look at is we'll do a month-long test, or we'll do a test right at the heart of that luteal phase, right around day 20-ish, if we have about a 26 to 28-day cycle, and we'll get a window where all the hormones are at. And then we'll work on supporting why that progesterone's low. Do we have a lot of adrenal imbalances? So we'll want to look at adrenals and cortisol rhythm. We'll want to look at progesterone, estrogen levels, and we'll want to look at why those progesterone levels are dropping. Of course, there's different things we can do to support that. We can, one, support the adrenals, two, figure out all the extra stressors in our lifestyle, diets, guts. We can use specific herbs to kind of help modulate that LH and progesterone rise and fall. We can use things like Vitex or Chase Tree or Shepherd's Purse or White Peony. We can use maca. We can use different glandulars. We can also use bioidentical progesterone. But you don't want to throw these willy-nilly, because this cycle didn't break like out of the blue. It happened for a reason. So you really want to make sure you're hunting down all of the underlying reasons. Like conventional medicine's known to throw progestins at this issue. Progestins are literally just horse progesterone. Now, why horse progesterone? It's easier to patent, right? And so they kind of create a patent based on things that aren't natural. You can get bioidentical progesterone, but horse hormones were typically used. There's lots of studies on progestins helping hemorrhagia and heavy bleeding. So got to get to the root cause of why that bleeding's heavy. And then if you follow the whole progesterone theory, why is the progesterone low? And then with low progesterone and heavy bleeding, then that also creates anemia and low iron, and that can create mitochondrial issues and now thyroid issues, because now your iron's low. You can't bind oxygen to hemoglobin. Without oxygen, you can't engage in healthy aerobic metabolism. Thus, your mitochondria, ATP, is screwed, right? So you can see all these different things. It kind of gets overwhelming. Like one thing compounds, then the next, and the next, and the next, and it's like, crap, what is happening, right? It just accumulates and it becomes very overwhelming. And so I just try to demystify it for you, try to treat you guys like your doctors yourselves, and just kind of give you, okay, this is physiology 101, right? This is what your doctor's not telling you, because they don't have the time, because insurance pays by the minute, and it's like 3 to 5 minutes, you're gone. And two, you got to deal with people that have a heart of a teacher. So that's me. So I want to make sure you have an understanding of physiology 101. You may have to go back and listen to it again. And then when you're listening, kind of look at the different root causes, because you probably have multiple happening. You probably don't just have a progesterone deficiency. That may be a possible tool we use in the functional medicine tool belt, but we want to think about this holistically. So I hope you enjoyed this video. If you did, feel free to click the like button, give me a thumbs up, put your comments down below. Let me know what you like best. And if you want to reach out to myself as a patient, there'll be a link down below if you want to reach out. I'm here to help everyone worldwide. My staff, we have staff and other colleagues that help out with patient load as well. So I'm looking forward to help anyone out that needs it worldwide. All right, y'all. Hope you had an awesome day. I'm going to go check on questions and see if we have any. All right. What about DHEA sulfate, but not normal DHEA? So DHEA sulfate is primarily produced by the adrenal glands, so it gives a pretty good window into adrenal output of DHEA. And so the lower the DHEA sulfate is, the more the adrenals are kind of beaten up. So if I see very low DHEA sulfate and, bottom of the reference range, we're thinking there's a lot of adrenal stress, and we want to get to the bottom of that. And of course, you got to make diet and lifestyle changes. And you got to make sure sleep and all those foundational things are dialed in. The foundation isn't that sexy, right? It's not like this super cool, awesome protocol, but it's the foundation for a reason, right? If you don't put a foundation in your home, it's going to just fall when a storm or wind comes, right? So the foundation is the foundation, not that sexy, but I find a lot of doctors, they overlook the foundation. Do genetics play a role? For sure. I mean, obviously people learn how to handle stress from their parents. And so there could be a genetic predisposition for estrogen dominance and different hormonal imbalances. And of course, when stress is plugged in or caused or stimulated, that can affect these different issues. So of course, stress can then affect progesterone. Low progesterone then gets this whole female hormone kind of cycle going. And again, I just talked about like heavy bleeding with that low progesterone because my last patient was dealing with that. But you can have breast tenderness, mood issue, cramping, headaches. All of those things can be major roles on that. What are issues that we can have in the follicular phase? So most women aren't going to have a ton of symptoms in the follicular phase unless they're dealing with a whole bunch of issues from menstruation. Like if you're bleeding, just like, let's say you're spotting a lot, right? Technically spotting, you don't enter the follicular phase until you bleed. So if you're just spotting a little bit, that's kind of the last half of your cycle from the previous month, and that's usually because of that lack of really good punctuated progesterone drop. So that's usually why that's happening. And so if you're having a long cycle, right, the first half of your cycle, like a lot of bleeding, like let's say 6, 7, 8, 9 days, that can obviously affect your follicular phase because now you're just, instead of building up your uterine lining, right, you're just sloughing it off, and that's because you probably didn't slough it off the previous month, right? And because your hormones are out of balance. So obviously you're not going to be spending time building up that part. A lot of times you can see estrogen rise and falls, and this can cause migraines. So headaches are pretty common as well. That's definitely a possible thing that you can see. Most women are going to have symptoms in the luteal phase because that also leads up into premenstrual, right? Premenstrual is right before you bleed, and that's where PMS comes from, right? Premenstrual syndrome, PMS, or you can have premenstrual dysmorphia, which is basically PMD. That's like the extreme version of PMS, essentially. And again, that's usually where you're going to see most of the problems is leading into PMS because that's where the cycle basically restarts. And so that's where most of the problems happen because all these hormones have to kind of come down and kind of coalesce together. And if they kind of coalesce too soon and fall out early, like I showed in the pictures, that's going to cause problems. All right, so I hope you guys enjoyed that. If you did, give me a thumbs up, comments below, and I hope you guys have a phenomenal weekend. If you want to reach out to myself, click down below. You'll see a link there, justinhealth.com, and you can click on the Work with Dr. J button. All right, y'all, have a phenomenal weekend. Take care of your health. Bye now.